I'm Audrey Forka, psychiatric nurse practitioner and Frontier Nursing University DNP student. Today I'm going to share a few takeaways from a critical appraisal on a small research bundle. In adolescent at risk for depression, how does a school-based yoga intervention compared to no intervention impact coping skills? First, here are some startling statistics to lay the foundation for this critical appraisal. 2001 CDC data indicates 7.1% or 4.1 million children and 3.2% or 1.9 million children ages 3 to 17 years old are diagnosed with anxiety and depression respectively. This means 2 out of every 25 students suffer with depression, and sadly, only 1 out of 5 receive treatments. Using the CAD tool, I appraised the Level 1 study, the slightly old but reportedly updated 2009 Clinical Practice Guideline by SUI on behalf of the U.S. Preventative Health Task Force on screening for anxiety and depression in children and adolescents. Overall, the guideline is well researched and reviewed by a non-biased, credentialed group of experts and presented in a user-friendly format with links for additional information and screening tools. The CPG gives a grade B, indicating that the benefits outweigh the risk of screening for depression in children 11 years or older, with a caveat that organizations who conduct screenings should have systems in place to care for and treat children who screen positive. The CPG gave an I, or inconclusive, for screening children under age 11. Next, using the JBI tool, I critically reviewed a Level 2 research by Frank and colleague titled Effectiveness of a School-Based Yoga Program on Adolescent Mental Health and School Performance, Findings from a Randomized Controlled Trial. Study authors declared a potential conflict in that one of the authors is a co-creator of the intervention being studied, Transformational Life Skills, a yoga-based skills training. Randomization method of the small convenient sampling of 159 students was not clearly defined. Authors hypothesized that students exposed to Transformational Life Skills yoga program would report improvements in general mental health and well-being and greater levels of school engagement and academic performance. They also anticipated that the treatment group would report significantly higher levels of active primary and secondary coping strategies and lower levels of somatic symptoms compared to controls. A careful review of study results revealed only 3 of the study measurement indicators showed statistically significant effects, specifically higher school engagement, fewer detentions, and fewer unexcused absences. The authors suggest school-based yoga is a strong potential universal method to promote positive school behavior and school engagement among middle and high school students in inner-city urban school settings. The study overall was fair in its design and data analysis and presentation. Although study results showed effectiveness in few areas, further research is needed. Finally, I took a critical look at a Level 5 research, a qualitative study by Dorietis and colleagues, investigating urban elementary and middle school students' perspective on stressful experiences and use of skills learned during a mindful yoga program. After implementing a mindful yoga intervention, study authors conducted a focus group with 22 student participants to capture their perspective on what constitutes stress and how study intervention influenced their behaviors. The study overall was well designed. Shortcomings included potential bias in participant selection. A synthesis of this small research bundle of 2 very good and a fair quality study indicates screening for depression where systems are in place to provide treatments in at-risk adolescents ages 11 or older can be effective intervention to improve school engagement, reduce absenteeism and suspension. It also reveals adolescents who participated in mindfulness and school-based yoga activities were readily able to apply techniques including deep breathing, visualization, removing self from stressful situations, thinking before speaking or acting, and practicing yoga poses or stretches to ameliorate their stress and anxiety. Although all the studies were conducted in school settings, the screenings and intervention can be easily replicated in other clinical and community-based settings, such as inpatient and outpatient behavioral health units, partial hospital programs, intensive outpatient programs, after-school and recreational camp programs.